Hello everyone, Dr. Paul Kilgore here, and today I'd like to talk to you about norovirus. Yes, this was the virus that was originally called Norwalk-like virus, or Norwalk virus, and it was discovered in 1968. Now, Norwalk virus itself is a worldwide infection. It is located in virtually every country where we've looked for it. It seems to be responsible for over 600 million cases of norovirus gastroenteritis a year. So that's a huge number. Also, it can kill. So about 200,000 deaths worldwide are believed to be caused by norovirus. Norovirus is in the family calicivirus. It is a very, very tiny virus, but it packs a wallop because only about 100 virus particles are able to cause disease. And the disease that it causes is something you've probably heard about before. So nausea, vomiting, diarrhea, abdominal pain. Sometimes people can have low-grade fever as well. But the thing that is really quite dramatic about norovirus infection or gastroenteritis is that it can cause about 60%, 60 to 80% of all foodborne outbreaks, foodborne diarrheal outbreaks. Why is this important? Well, one of the things that's so important is that when we have people handling food who are sick, or who have had Norwalk virus infection recently, they can contaminate the food. And so we've seen food workers actually contaminate food in restaurants and buffet settings and even special events. And when that happens, the virus can contaminate the food and then be transmitted to you. We've done viral outbreak investigations before, and in some cases it can contaminate salad bars or other foods in the facility. So one of the things I want to make you aware of today is that Norwalk virus can be transmitted from person to person. We know the primary route of transmission is really what we call fecal oral. So that means from feces or from stool to your mouth. What does that mean? The first thing it means is that you need to wash your hands. If you're in the midst of an outbreak, or if you know someone around you may be sick with gastroenteritis, one of the most important things you can do is wash your hands. The other thing I wanted to mention is that when someone has a norovirus infection and they're sick in the home or a facility, or perhaps even on a cruise ship, if it's possible, the isolation of that person and isolating the facility, the bathroom that they use, would be a really great idea. Short of that, if you can't do that, one thing I would recommend is making sure that you wipe down the environmental surfaces, meaning the countertops, the door handles, anything where the virus could land, and make residents set that a place to clean up very carefully. So you can wipe it down with an antiseptic or disinfectant, spray it down, let it dry, because the virus is very, very hardy. So when it lands on the surface, after someone vomits, for example, then it can stay there for a long time. And what it means is that you can actually pick up the virus. You can pick it up on your hands, or if it's airborne, if the person recently vomited, sometimes the virus can actually stay airborne. And in dry air, in a dry environment like during the winter time, we tend to see an increase in these cases because the virus can stay airborne for a long time. Now, when you're in the midst of an outbreak, what else can you do? Encourage everyone else to wash their hands. It's a very important strategy. Right now, when we talk about protecting yourself from the disease itself or from the effects of the disease, there's a couple things to know. The first is that normal, healthy people can recover pretty quickly. So when you first get exposed to the virus, you have a waiting period, that incubation period, about 24 to 48 hours. After that, symptoms can begin, and the symptoms can be quite dramatic. One of the most dramatic symptoms of norovirus infection is what we call projectile vomiting. That's vomiting where it can be very sudden, very violent, and the person may not even know that the vomiting is going to come. But when it comes, it's violent, it can be severe, and sometimes it can be painful. When you have projectile vomiting, it means that the virus is going to be set into the receptacle where the vomit goes, but also keep in mind that when you vomit, some of that spray or some of that vomit can become airborne. Yes, and that means the virus becomes airborne as well. That's how it lands on the surfaces, like a tabletop or another part in the room where you're vomiting. So, when you are sick with norovirus, there's a couple things to try to do. Number one, try to get some anti-nausea medication if you can. Sometimes this medication is available in an emergency department. We don't have a lot of over-the-counter good anti-nausea medications. So the other issue, of course, with norovirus is that when you are sick with norovirus, anything that touches the stomach tends to come right back up. And it's because the stomach is very sensitive at that point. And so it can be very difficult, if not impossible, to keep any fluids down or keep any medicine down. One medicine I have found can be very, very helpful is something like a Pepto-Bismol, but not the liquid. I tend to take the lozenge or the wafer that you can chew. It's chewable, and you just let it melt in your mouth, and it can soothe the lining of your gastrointestinal tract. That can calm down your stomach in some cases. It's not a guarantee, but it can work. I've had good experience with that. Pepto-Bismol or a similar product can also help reduce the diarrhea. Now, with vomiting and diarrhea in the normal person, most people can tend to get through that pretty well. The virus can cause disease and you'll be symptomatic for maybe 24 to 48 hours. At the outside, maybe 72 hours. But for people who are immunocompromised, people who are elderly, or the very young, this virus can cause a lot of trouble. So, I have a couple recommendations. If you are very young, or you're a parent and you have a child who's sick at home with vomiting and diarrhea, watch them carefully. If they're able to take little sips of fluids, that's great. But be careful because sometimes the vomit will come right back up. Now, if it's an elderly person or if someone has a pre-existing medical condition, and here I'm talking about things like heart disease, congestive heart failure, diabetes, type 1 or type 2 diabetes, chronic kidney disease, or they're on an immunocompromised medication regimen, or they have other pre-existing condition that makes them very delicate or vulnerable, these are people you want to watch very carefully and have a very low threshold to taking people like that to the emergency room. Why? Because they can become very dehydrated very quickly, and they also can have their electrolytes get out of whack very quickly. And when I say electrolytes, I'm talking about potassium, sodium, magnesium, other things like that. These chemicals, these electrolytes in your body are very important to maintain what we call homeostasis. Good organ function, good heart function, kidney function, and brain function. So when you think about keeping people safe with norovirus infection, it's very important to make sure you watch them carefully and get to see a doctor, get to a health facility, because then they can provide the hydration by vein. And the hydration by vein will come with those electrolytes that I just mentioned a minute ago. We tend to see diarrhea and vomiting together in this illness, and that can be really double trouble in vulnerable people because you lose electrolytes through vomiting and you lose electrolytes through the diarrhea. Okay? Now, keep in mind, with norovirus infection, there is no antiviral treatment. We don't have a good medicine that will cure this disease like we have for influenza. We have Tamiflu for influenza. We don't have an antiviral medication for norovirus infection. So norovirus can be everywhere in the world, and so when you're traveling, beware. When you're out on a cruise ship, beware. When you're out eating, beware, and be watchful for other people who may be sick around you. And always take care, because one of the things that we know is that as we move forward, we're going to encounter this virus. It's everywhere. There's many different strains of norovirus, and that has actually presented a major challenge when we talk about vaccine development. There are a couple of vaccine candidates that look pretty good for norovirus right now, but because of the antigenic variation of this virus, meaning there's many different genotypes or other classes of this virus, it can make it very challenging to make a very effective vaccine. But we're working on it, so stay tuned on that. The other thing I want to mention is that the virus can affect many different populations. We see it in the military, we see it in people eating seafood or shellfish, we see it in people on cruise ships. It's very common, and in fact a couple weeks ago that was reported. It can occur in schools, and one of the things about the virus is that it can be easily transmitted. It can be airborne. So I mentioned the fecal-oral route of transmission earlier. We also can see person-to-person transmission because when it's airborne, it's almost like you're passing a respiratory virus from one person to another because it's spread through the air. So when you're out and about, just be aware this virus is there and something that you can protect yourself against. Now, many people have thought and talked about probiotics for norovirus. This is a very interesting consideration, but right now the data suggests it's kind of a mixed picture. We're not really sure if probiotics are going to protect you or prevent norovirus infection. We're not sure also if you take probiotics after you recover from the major illness, if that will help improve your gut function. There's some evidence that bringing in the probiotic strains after you recover may help your gut microbiome recover faster and get back to a better baseline. Because one of the things that does appear to happen with norovirus infections is that it does disrupt your normal microbiome pattern. In other words, some of the normal bacteria that are there in your gut before you have the norovirus may disappear or go down in population after that virus infection. So we do believe that norovirus infection can have an impact on the gut, maybe a little bit more long-term than just a short-lived illness. So one of the things that's very important with your norovirus infection and the gut is to, number one, watch for symptoms. If you do have symptoms, try to make sure that you have an anti-nausea medication if you can. Try to find something like a Pepto-Bismol. And if you're able to take hydration fluids at home, that's great, by mouth. But just beware, when you are in the midst of the illness, your stomach is very sensitive and the liquid can come right back up through vomiting. Now, if you are sick at home, just beware again. Make sure that you're watching people who are very elderly, very young, or have underlying medical conditions. If you have someone like that at home or with you, you want to make sure you locate the nearest emergency room and just be ready to go there if you need to seek medical care. Because you don't want these people to get too far with dehydration or too far with the fluid loss that can lead to low blood pressure and also that electrolyte disturbance that I mentioned. And you don't want to get in that situation because catching up after that happens can be challenging. So you need some medical help at that point. Okay? So I hope that helps today, and I'll be back with more information on norovirus and other great interesting things, and hope to see you again soon. Thank you very much.